So CyberKnife is a machine. It delivers something called either stereotactic radiosurgery or stereotactic body radiation therapy. We know that for certain kinds of cancers, very, very high doses of radiation given over short periods of time can be curative and significantly help with symptom relief. CyberKnife is a small radiation machine that's located on the top of a robot. The robot actually can rotate around the patient's tumor site pretty much in any direction. This allows us to target tumors and minimize giving doses of radiation to normal structures around the tumors safely. So it's been shown for certain kinds of cancers, for prostate cancer, early stage lung cancer for patients who either can't have surgery or who choose not to have surgery, for unresectable pancreas cancer, for certain liver tumors and brain tumors, that this type of technology is the most effective technology to treat cancer patients. CyberKnife is not the right treatment for all patients. We individualize the treatments we give to each patient that we see based on where the tumor is, the size of the tumor, and also the patient. We individualize treatment for each patient. The differences between CyberKnife and some of the other forms of radiation that we have to offer is typical kinds of radiation machines are effective at rotating pretty much 180 degrees around a patient, whereas CyberKnife's on a robot, so it can rotate really in every direction around the patient. CyberKnife only can treat limited tumor sizes. So for bigger tumors, CyberKnife is not the right machine. And again, when we're giving very high doses of radiation over shorter periods of time, we need to make sure that the tumor size is small enough that we're sparing normal structures and not over-treating things that should not be receiving radiation. Another difference with a CyberKnife machine versus other technologies, for example, is if you're treating a patient's lung cancer, the machine can actually track respiratory motion. So you're tracking the patient's breathing cycle, and you're tracking where the tumor is moving during the patient's breathing cycle. So you safely can deliver the radiation where it needs to go and not, because tumors move, tumors in the lung move, tumors in the liver move. So we're tracking respirations to make sure that we're targeting the tumors and not targeting normal structures, which is very different than most other technology. The other way that CyberKnife is different, for example, for prostate cancer, is the prostate can move significantly over periods of time because the bladder, which sits in front of the prostate, is changing. The rectum, which sits behind the prostate, is changing. So even a gas bubble in the rectum can move the prostate. And with CyberKnife, again, we're imaging. There's low X-ray imaging cameras in the ceiling of the room, which are imaging what you want to treat approximately every 15 seconds. And so the machine is moving where your target is moving approximately every 15 seconds if necessary to ensure, again, that the radiation is going where it needs to be delivered safely and sparing normal tissues around what needs to be treated. CyberKnife is one of the latest technologies that we have. We know, again, for certain kinds of tumors that very high doses of radiation over shorter periods of time are more effective at killing cancer cells. CyberKnife is a machine that enables us to do this safely. Over time, in the past, for example, prostate cancer used to be treated over 9 weeks. There's more and more science showing us that shorter courses of radiation targeting prostate cancer can equally cure prostate cancer, and it's also more convenient for the patients because they don't need to come for as many treatment times. So CyberKnife enables us to be able to give this treatment for patients with prostate cancer safely. Another difference for CyberKnife, for example, for brain tumors is in the past, we used to have to have the neurosurgeons lock on head frames for our patients, and those head frames would then be locked to a table to target the tumors and prevent the patient from moving. These head frames are less comfortable for the patient. For example, for Gamma Knife, which is another treatment modality to treat brain tumors, you do actually have to lock these head frames on to target the tumors. CyberKnife is a frameless delivery system, so we don't have to lock the head frames onto the patient's skull. We can make a mask that keeps the patient's head still without actually putting anything into the skull. And then again, we're imaging the patient's movement every 15 seconds to ensure that the treatment is given to the tumors and sparing normal tissues around the tumor, and it's a much more comfortable process for our patients.